So you guys understand what is the definition of tennis elbow and inject, jerk, twist close, and open can, and even open the screw or is line and suddenly like punching, hope slide in slide. Alright, just testing. Alright, the first thing you can see the third and fourth finger, usually on the third and fourth finger, rotation will affect the tennis elbow line. Alright, very easy. There are a few ways to do the tennis elbow. The first thing, the most easier things is using the coin. Ding, 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 coins. And how you check? You can move around. You can see the dot is moving. You can see this one dot. Ding, 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 ding. See, like tinkling. You can see the vibration here and here. This is what you want to see. This is the main point. So whenever you move your finger like this, like swimming, ding, 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 then you can see this part over here. And the main point, you try to press over here. Wow. Whatever you press here, you feel the whole hand is numb. Even I try to put like this and it cannot. The easy way, you put the 50 coins or any coins put around here, whatever you can try around. Whatever you press here, or maybe on top of what, you find the point is very sharp pain. I put in here. I can feel it. What you do, using a plaster to glue it up. Like this. How you glue? Let's say you want to DIY yourself, very easy. You just put on your leg and snap it. So the coin is over here. And don't rotate and what? You just like this and press here and push on top first. Push on top. And the most important, you can see using the downward and press very hard. Pull very hard. And press very hard. Now you can see the coin on my hand. Now you can see the coin is moving. But this is called a compression. Actually, the tennis elbow is between the tendon and ligament to overwriting. We call it entrapment. What we do is this part is putting the coin to separate and the coin on top and press. Whatever press already, you try to move it, feel better. Now I press it, good. So try again. Okay, try again. You see this hand, normal hand, perfect hand. I can rotate left, right, left, right, left, right. Just now my this hand until one side and feel sharp pain here and pulling and the pain part. Even I lift up like this also painful. Now take like this and slowly rotate. It works. Wow, see? You see? Another one more time. Actually, I injured 2 hours ago. Again. Yeah, correct. Good. And third one. I feel like a tingling sensation. Whenever you feel the tingling sensation means correct. It's compressed. Actually, the tennis elbow is between the core overlapping and scratch. That's why painful. Now it's easy for me to turn like this, or using the doorknob, try to turn like this, where they cannot get up. This one so easy, but this one now much more. See, much more easier. This is one of the faster way to release the tennis elbow, and try to open back again and see. So without the coins, now try it and see. See, maximum only, cannot really. One more time, holding and rotate. See, my whole hand is shaking, cannot turn. Not easy to turn. It's quite painful. So now I understand the tennis elbow, how I feel. So I put back on this point and tie it up very hard. Start it very hard and rotate. And this part straight again and rotate. actually it's work. See, actually it's work. More easier. And push up. Good. And the second thing, try back. You see, I'm using the water, and rotate. Here is a normal hand, and can rotate over here. Easier. And easier. And just now, this one cannot. Holding. I feel the sensation here. Alright. A bit holding sensation. And turn to the side. Good. Not so pain already. Wow, I feel a little bit tingling on the third and fourth finger. And here. Yes. Good. Actually quite effective. Alright, the second thing to exercise back to the tennis elbow, you can stretching like this. Pull every morning, wake up early in the morning, you straighten your hand maximum, straighten your hand and pull your finger up. For how long? You can do about 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. Very good. And how about down? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And down again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this is one of the way to release for the tennis elbow. Because why it's called entrap. Okay. So now, of course, this is a temporary to let you feel better and what. This is not a cure part. So the cure part, now I teach you the DIY, how to fix your tennis elbow. You can see a lot of my video. My video is very easy. I just holding people hand and jerk and like this jerk. So what is the definition of this jerk? Especially holding here and snap in and out. After pop, then if you really all the movement and straight and then no more pain. So let's say, but this one you can try at home. You can do it by yourself. It's one of the technique I do it from now because now I'm quarantined myself and no one help me. The only person who can help is myself. So see whether it's work or not. Okay, I take it out this one without this one first. Without this one. Now check back again. This side. Oh my God! See the strength. Okay, better than just now. Much more better than just now. And can rotate. And this part, I feel the pain, but not as flexible as just now. Okay. So at least I can feel without the coins. Then I can feel the vibration and the pain. And even now I try to rotate back to this circle. It's much more better than just now, but it's still got vibration. Alright, the DIY for this one. You see, this one. You got two knees together with you. So this one, how to fix? So fix is not punching, not punch. Punch, not punch. Though, if you punch, it's more injured your tennis elbow. Because usually you can see all eye treatment is holding like this and snap, pop up, pop up. It is a correct things. And now you see, you put your hand together and using your two knee to grab your hand. So where to grab? You grab like this or grab like this. They have the difference one. So for me, I will say, I will grab straight line. Okay, you can see if like this, no point. Because you can't use your strength on like this. You move in and out only, but you cannot move out and down. So the purpose, you want to entrap this one and open up the tennis elbow, your hand must be straight. Must be straight and grab very hard over here to here. See, and then pull your hand out, and if possible, you can feel this part. See here, yeah. You can feel the grip over here. So what you do first, grab very hard and pull your hand up a little bit. And this hand next to your waist and try to push this side. How many strength? You just like push a little bit only. Okay, you try to hear the sound. Đấy. And front. Talk. Hear the sound, tick tock. That's all I want. Wow. Alright, so just now what I'm doing, I'm locking on this part position because our elbow from the waist, from this line, there are two bones like this. Whatever you can see this hand, they are straight line like this. Whatever you turn, the bone is called like a chopstick, compressed over right thing. You just imagine, here is one, and here is one, and connected, okay? Whatever I rotate, you can see the line is the opposite direction. It's called entrapment. So this is very important because why straight and bend, you can see the bone over here is entrapped from here to this point to this point. So again, put over here, wrapping, and not like this, don't grab like this, because this one you have no purpose to turning. You put like this, holding like this, hand to your two knot and thumb over here and push in slightly, and rotate, and 45 from back to front. Wow, hear the sound again, small sound. All right, now my hand a bit numb because of the circulation. I everyday trick people also same thing technique. So that's why this is one of the frozen, what I call the tennis elbow injury. You can do that. Now let me check back. My left hand, very easy, like gear knock, rotate. How about and the right hand? Yes, more and more flexible. So you can see, more and more flexible. So my neighbor say hi to me. So, see? Yes. Yeah, very good. I can feel the difference. You can see the point. Good. Whatever now, you can see back. This is the tingling point. This is called tennis elbow point. And I press back over here. See, not the pain already. Actually, it's quite effective. So this is one of my DIY for the tennis elbow. And try to can repeat the action. Yes, I can do that. Repeat the action. All right. Just recap back. So before we end, we recap back. So usually for tennis elbow, injured is due to like a lot of people like to sleep on one side. Sleep too long, and this is a rotate and effect. Then suddenly, early in the morning, you wake up, you can't take your bag or cup of coffee also. Wow, no strength at all. Then the second thing, a lot of people like to screwdriver and suddenly unstop, then and trap the nerve also, and the jerk people, and also open the can. Sometimes open, pop, got one sound, pop. This one also misalignment, and not tennis elbow because of due to the during tennis playing tennis got injured. There are many kind of sport also can injure the tennis elbow, not only. But for me, I think I got 10 patients injured the tennis elbow. I think about 2% playing tennis is injured. The another 8 is due to another one. And checking like this in and out, and checking this part in and out. Yeah, now it's moved. And usually you can use a what I call bottle, fill up the water and rotate from this angle to this angle. Wow, more strength really, good. See, more strength. So how to fix for the DIY for the tennis elbow? You want this point and trap on top. You want to open up like this. First thing, you can find the very short point part. You're using, putting the points on top, put over here. You try to put exactly on the pain point. After the pain point, you glue on top first. Then the bottom part, you try to pull as hard as you can. Pull as hard as you can. So we can feel, yeah, tingling, no more pain. Then the second thing, how to fix. So give your hand, don't like this, not like this, not like this. Try to flat, stem line with you, flat using your knee to grip. Now, grip, cannot move freely your hand, like someone lock your hand. Then using your another hand from a sideway, locking your sideway over here and grabbing hard and try to push front, the jerk, small velocity of impact. Like this. And the second one, push at the back and push the front, little bit strength on it. Okay, not too hard after you broke your wound, then you have to look for me. Got another sound. Now, hear a very gentle sound. Click. Or hear a little bit like a tendon, it's like a bubble sound. That should be okay. Then after that, you can try back. How you try? Turn. Turn. See? This is called perfect hands. Wow, like this also turning also can ready. Like a knock, knock, knock. Alright. So guys, hope you all guys learn this variable technique to fix your tennis elbow, and hope you all guys stay healthy and DIY. And I'm Chris Leong. Thank you very much, and I see you guys tomorrow 6:30 same time.